am Dr. Nagarajan, practicing in Chennai. I am a diabetologist and a general practitioner. Today we are going to discuss about understanding hypertension. Our today's discussion will be on what high blood pressure is and how to prevent it. Generally, everyone would like to have healthy and normal blood pressure, but what exactly does it mean? Basically, each time when the heart beats, it pumps blood into the blood vessels. This creates pressure against the walls of the blood vessels. This is called blood pressure. Normally, in a healthy person, it rises fast throughout the day. But when the blood pressure remains high for a longer time and left untreated, it can lead to serious health complications. In general, persistent increase in blood pressure higher than normal pressure, known as a hypertension. High blood pressure usually develops over time. It can happen because of unhealthy lifestyle. Choose, for example, having enough regular physical activity, obesity, smoking, high alcohol consumption, and stress, etc. There are other risk factors that can increase the developing hypertension, such as age. As greater older, the arteries can stiffen up and narrow and excess fat builds up. Family history of high blood pressure and excess salt intake and eating processed and fatty food increase fat throughout the body and make heart work harder to push blood through the body. And the other one is stress. Creating a stress to unhealthy ways and not managing stress can also increase the blood pressure. Moving on, hypertension does not have any obvious sign and symptoms. That is why it's called often as a silent killer. It puts people at a risk of several diseases from cardiovascular problem to kidney failure, stroke, and even eye damage for the blindness. Hence, every and accurate diagnosis is very important to management of the hypertension. Measuring your blood pressure is the only way to who person have high blood pressure or not. When symptoms occur, they include morning headache, tiredness, vision changes, buzziness of ears, fatigue, nausea, and vomiting. If a person is experiencing some of these symptoms, immediately check the blood pressure. Fortunately, high blood pressure can easily diagnose. Usually measured with the instrument called sphygmomanometer, a blood pressure is recorded in two numbers, systolic and diastolic. Now let's try to understand what to do these numbers actually mean. Healthy or normal blood pressure should be lower than 120 to 80, and it can also read 120 over 80 mmHg. Here the upper number indicates systolic and the lower number indicates the diastolic. It means pressure in the blood vessels where heart contracts, wherever lower number indicates diastolic pressure. If blood pressure level is more than 140/90, then the person have hypertension. The person have a BP levels higher than this, then she is might to risk developing serious heart disease. The risk can be prevented reducing taking steps towards healthier lifestyle such as regular exercise, healthy diet, quit smoking and alcohol, regular blood pressure monitoring, stress management, and other medicines. If blood pressure is successfully controlled with such lifestyle modification, then it may avoid delay and reduce the need of medication. Regular exercise or physical activity. Exercise can be a drug-free approach for lowering blood pressure, and regular physical activity makes a person heart stronger. If one can have a strong and healthy heart, it can pump more vessels to the heart. So the heart has to work less pump, and the force on the blood vessels will decrease and lowers the blood pressure. In other cases, we all aware of the age and weight gain for the two major risk factors for the high BP. So the blood pressure is at a desirable level is less than 120/80. Then the exercise can help prevent it and rising your age. Regular exercise also maintain a healthy weight, which in my opinion is an important way to control the blood pressure. One should aim at least 30 minutes of aerobic activity most days a week. High BP level can reduce doing regular structural exercise such brisk walking, jogging, and swimming. Healthy diet. The diet also plays an important role of controlling blood pressure. The diet with the high intake of vegetables, fruits, grains is recommended for hypertension patients for lowering blood pressure. Or preventing hypertension through dietary intervention, one can adopt a pattern such as DASH diet, eating less saturated fat, total fat, and getting plenty of potassium, limiting the amount of sodium in the diet, and limiting alcohol consumption. DASH stands a dietary approach of stop hypertension diet. Each diet has a grain, fruits, vegetables, low weight dietary product. Skim on saturated fat and cholesterol can lower one blood pressure by up 11 mmHg if having high blood pressure. Reduce the sodium in your diet. Read food labels if possible. Choose low sodium alternates in a food and beverages you normally buy. Eat a fewer processed foods. Only a small amount of sodium occurs naturally in food. Most sodium is added during a processing, so you can eat natural food. Do not add salt. Just one level of teaspoon of salt has 2,300 grams of sodium. Avoid adding salt to food. Use herbs and spice to add flavor to your food. Quit smoking. Stopping smoking helps your blood pressure return to normal. Quitting smoking can effectively reduce your risk of heart disease and improve overall health. Regular blood pressure monitoring. Some of the hypertension patients check their blood pressure by visiting doctors, but it is not always possible for patients to visit doctors and check up their blood pressure. Hence, most often I advise patients self-monitoring for their BP levels. If self-monitoring helps person to measure BP at different times throughout the day and over a longer period of time. It also assists doctor to get more complete picture of the person blood pressure reading at the different times. Further help us to better prediction of the cardiovascular mortality and morbidity rather than a single routine blood pressure measures that occur during a clinical visit. Stress management. By learning how to relax and manage stress can improve emotional and physical health and lowers high blood pressure. Stress management techniques include exercise, listening to your music, focusing on something calm and peaceful and meditating. Other thing is medicines. Adherent to the medicine. Medicine to lower blood pressure may recommended by doctor. If your blood pressure is consistently high, usually above 140/100, medicine is very important to control your blood pressure regularly. At last, I could like to suggest that there is nothing more precious having a fit and healthy life. Adopting a healthy lifestyle can help us to enjoy long and healthy life. Blood pressure can be prevented as well as controlled in many ways. Keeping blood pressure in a normal range and is very important in preventing cardiovascular complications. It's very much possible to maintain normal blood pressure level with a regular monitoring and preventive care. So I think take home message is always check the BP regularly when you are more than 40 years and any smoking, alcohol, any other habits can be quit immediately and a regular periodic checkup for every year more than 50 years is advisable and God bless you all. Thank you very much.